Good morning, everyone. My name is Paula Chavis. I'm Mount Sinai Missionary Baptist Church Administrator. This morning, our women ministry has sponsored a walkathon here at Booker T School. We will walk 1 mile around Booker T School. Before the walk, we will have prayer and a balloon release for all survivors. At 10 a.m., we will have a presentation. A representative from Gulf Coast Health Center will speak on renal disease and breast cancer as well. Our proceeds from our walk will be donated to Winners for Life organization to support women who are uninsured to pay for mammograms. If you like more information, you may contact me here at Mount Sinai Missionary Baptist Church, 409-982-6464.
Woo! And we're off! Woo!
Yeah. Oh yeah.
And I thought, I'm going to,
Oh, now, if we're going on, that's more than a part of it.
Hey, look, a whining niner.
Hey.
wave ladies, there you go. Yeah, let's go.
They playing games.
Uh-huh.
I don't have time.
Come on.
Okay.
She want us to hold up. You don't hold up when you walking. No, because your body gonna get cold.
Woo! Woo!
I do too. Almost there.
Hey.
All the pictures.
All right.
Photo. On everyone.
Jump on in. Jump on
No, we just turn around.
Y'all know how to do it. Y'all know how to do it. Just come on in. Just come on in.
Power corrupts, and it corrupts absolutely. Yes.
Hi, my name is Christina Boutte. I'm a breast cancer survivor. I've been a survivor for 10 years. My older sister, Wanda Queen Mitchell, we lost her years ago. Ladies, all I'm asking you to do that you go and be tested. Be tested, ladies. Knowledge is power. Knowledge is power. Thank you and have a blessed day.
Oh yeah, that's okay. I got it. But I wanted around this too.
Okay. So you can put your brochures and stuff in. Hey, Miss Duncan Dale.
Good morning. How are you?
All right. All right.
Don't trust him. Don't trust him.
You'll want to get right there.
Good to see you, man.
Oh, yeah, they can
Yeah, take them. Good morning, everyone. Feel free. We got a lot of information up here at the resource table. Please feel free to get as much as you need, as much as you like that you utilize. It's free and it's open to all of you where you can take part of it.
Morning. Oh, you all don't know how pretty y'all look. Golly. Pink, 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 pink. It's beautiful. Thank you so much for coming. Before I start running my mouth, Sister Bertha, will you give us a prayer? As most of you know, I'm Geraldine Robinson, the leader of the women's ministry. And we planned this event today, along with other women of our church, that we wanted to put emphasis on breast cancer awareness. We'd like to welcome all of you to the Breast Cancer Awareness Observance. As you know, breast cancer is a serious disease that affects countless women each year. We are here today to receive information on how we as women can protect ourselves from this disease and pass this information on to our loved ones. So again, I say to you, welcome and thank you for being here.
Amen.
Before we get started, I would like first to acknowledge some breast cancer survivors in our congregation.
Amen.
The first person is Christina Boutte. She is preparing lunch for the funeral people today. So she's working in the kitchen. But she is a 10-year breast cancer survivor.
Amen.
Then we have Sister Betty Watler. Betty, would you raise your hand? Because we want to put you on video. She is a survivor for 2 years plus.
Amen.
Then we have Sister Ella Duncantail. Raise your hand, Sister Duncantail. Sister Duncantail is a 1 year plus survivor, and she's currently taking treatment right now. So let's just give these ladies a wonderful welcome, and we're so proud that they are so brave. They are Christians, and they know that God has brought them through. Yes. Now we want to introduce our speaker for today, our guest. From the Gulf Coast Health Center, and she will bring us all of the information we need on breast cancer disease. This is Sister Sheila Jordan. Let's give her a hand.
Thank you for having me. It's been very exciting. Yes, again, my name is Sheila Jordan. I'm a certified nurse midwife and a family nurse practitioner, and I work at Gulf Coast Health Center probably for the last 13 years. Yes. I didn't have, I kept thinking, what can I say? Most everybody knows about breast cancer. Everybody almost get an attitude where, oh, we're so tired of October being Breast Cancer Awareness Month. But I think besides 1 month, I think it's something that we need to be aware of year round. In a group full of women, of course, there's a couple of men here, so it does affect men, but much less than women. And when you look at averages, well, what I had outlined was ABC, so one of those A words. The average risk of just anybody, whether woman of any race or color or part of the world or country, is 1 in 8. That's a lot of people. So anyway, we want to be awakened to that fact and be awake and ready for the battle. We're talking about the battle. And especially in this room today, and my research I've done to get here today, I said, what we need to talk to in a room of women that have African descent, and stuff I'm learning, and I think even just the medical field has been rolling out new information about genetics, the descent of Africa, and the different types of breast cancer, and now we're able to test tumors when it's diagnosed. And there's subtypes of cancers, and one that has called my attention is the triple negative. And I don't know if anyone's heard of that. Anybody heard of that, or anyone diagnosed with that? Is that a new word for you? Triple negative breast cancer.
Oh, wow.
Well, okay. Yeah. So take note of that, and probably look at some videos today. I looked at a few to learn a few things on YouTube, of course. Because then that's the A's, the awakening, and again, A of African descent. B is biology. To me, that's a bummer because it really hurts my heart that some things cannot be changed. That's biology. But there are things we can change, and we'll get to that about the change. And then, of course, C for conversation. There's courage, again, fighting cancer. It was about a year or so ago, I got a text from my sister, and it was the day after her birthday. She had just turned 53, back last year. She texted me and said, what should a woman do if she found a lump? If she should go to her PCP or her OBGYN? And I texted her real specific, because I figured with my sister, she's usually teaching someone she works with. She's a nurse also, not a nurse practitioner or whatever. But I told her it in plain, so she could copy it and paste it and tell her friend. I said, either one, if you can get into your PCP faster or your OB-GYN doctor faster, get into either one. And you'll need, if you have a lump, you will need a diagnostic mammogram and an ultrasound to at least start with. And while I had texted her that, and then the phone rang, and it was her, and she said, it's me. It's not, a friend. I know she knew, but she figured I was telling that my text was like as if she were going to tell it to a friend. So she called me, said, it's me. Can you come check me? And sure enough, it kind of hurt my heart to touch that lump in my sister. It was different than a patient's. That I've done there's been days in my career that I've checked 80 breasts a day with the Julie Rogers Gift of Life program. I mean, just breast after breast, so, touching and feeling that. You can usually pick things up, but again, there are lumps that are so tiny that you can't feel them on anything. But my poor little sister, I said, I didn't tell her you're gonna die. This is cancer, but I thought there's high statistics that this is cancer. So it was, and I tell you, it was very and she survived. She's alive now. It was very aggressive though. I could tell just from the day I checked it in June, and then she very, very fortunate that she got very quick attention and got in with the right people at the right time. The only delay was around 4th of July because everything was closed. So she had to delay a day or two on the days they do the biopsies. But anyway, it did come back. And hers was what we call it. Well, they look at these subtypes when we talked about triple negative. What they're looking at, those three things, they're looking at something, the receptor of the tumor cell, if it's receptive or sensitive to estrogen. You may have heard of this, or progesterone. Those are our two main female hormones. There's also a protein, you might hear commercials and ads about HERS2. It's interesting. It's a protein that's produced on the tumor cell that nowadays there are targeted treatments for that HERS2 positive cancer. There's treatments now, immune therapies and other chemos that target that. But so anyway, she had one of the hormones and she has the HERS2. She responded really well to the chemo, and then the surgery. She herself decided the one lump of the one breast, she decided to go ahead and get both breasts taken because when she started going on blogs and groups, and she was so scared of that future of it coming back and taking that other breast. So, and in this day and age, and I think just really in the last 2 years, they're developing more and more specialized techniques on the breast removal and the conservation of the skin and what that might look like, the rebuilding or restructuring. So she's really gotten really very good care at MD Anderson, and so she's awaiting now the final reconstruction. She did chemo and she did surgery to remove both. Her lymph nodes were clear after the chemo. When they do the surgery, that's when they kind of see, partly when they take things off, they look at it to see, was there still cancer left in that breast? Was there still, what's going on in those lymph nodes? So that's part of that cancer treatment and surgery. So she responded well. There was the tumor, let me back up, sorry, so from June to August 2nd when she started chemo, that tumor had grown more than double. It was 3 centimeters when I checked it. And then on the day before her chemo started, she came to our house and we had laid on hands and prayed. And, just knowing that was going to be a significant journey in life, 12 weeks of chemo and all that. But she says, feel it, it's bigger. She goes, I can tell it's bigger. I could tell, it was 6 or 7 centimeters. It was bigger. It had grown just in 6 weeks. But anyway, hallelujah, she's doing well. A new grandmother herself this summer. That's one reason she delayed the reconstructions, because she didn't want to be all sore and holding her new baby, grandbaby. But anyway, that was just the closest I've been, and going, you know, from day to day, each walk, each day she's been through. And again, the treatments are amazing, and but what was scary to me, and I heard the lecture I was getting information from, there was a doctor from Johns Hopkins was describing that when you think of the HERS2 positive, the estrogen and progesterone, and you think of the triple negative, she said, think of a house with all the doors, there's locks, but you have keys. So with the types that have the positive, if you're positive to estrogen, positive progesterone, positive HERS2, there are treatments like the key to treating that. With negative, it's like there's a lock on the door, but we're difficult right now finding the right key to open that and treat that. So it tends to be, if the triple negative is more aggressive, and it happens more often in African descent Black women. So good news is they are developing new treatments. It's not necessarily chemo, but it's immune therapy. So that's kind of, if you listen to the new buzzword, and when you look at the ads right now, because I heard one yesterday, I'm talking to someone, the radio was on, if you have HER2 positive cancer, metastatic, if you take this medicine, there's different brands out there, that those help prolong the life, and so they are working on new treatments for the triple negative, which to me right now is pretty scary. But we want to be of courage, and because there's always hope. And in this country, thank goodness, we have disparities, of course, in healthcare access, money, insurance, and things like that. But overall, the heart and the attitude of the country and the leadership and the healthcare, we want to do better, and we want to learn, and we want to develop more treatments. Unlike other parts of the world where there's not a lot of that going on. The government might be rich and resources and money, but there's so much corruption, there's not really health policies in the countries and in the continents of Africa. Actually, yesterday I had a conversation with a lady from Africa. She's a nurse. I want to be a nurse practitioner. She's a student of mine right now, but she's been in America for 5 years. She's a nurse midwife from Africa, Nigeria. And we were talking about what things that are going on in Africa and how there's a lack of that camaraderie. They don't have like a breast cancer awareness month, and they don't have policies in place where there's try to be fair to everybody. So unfortunately, in parts of the world, there's a lot of deaths from cancer, and a lot of misconceptions, and a lot of mistrust in the healthcare system. So anyway, we want to have for Americans, again, be alert, be ready, be your own best friend, be your breast's best friend, and have conversations. And again, be of good courage, but be ready for the battle. So anyway, clinical trials is another thing too. The clinical trials that are going on. Traditionally, there's not been a lot of Black women involved in a lot of the clinical trials, and I don't know why that is, and I don't know if that's fear of a clinical trial or mistrust from past doings in the medical field. But the lady from Johns Hopkins was very encouraging that there's more and more developments for triple negative breast cancer, because it is so significant among the Black women and just women in general. To test when they get that diagnosis and testing and knowing what your future may be. One thing is, of course, the journey through the intensive treatments and surgeries, but it's that knowing that future, because most cancers, we know that sometimes they'll come back. So anyway, I don't know, I think I'm starting to ramble now. But anyway, so anyway, does anyone have any questions or need me to backtrack on anything I've mentioned so far? Okay.
Well, I got a question.
Okay, yeah.
My mother had breast cancer back in the 70s, and they removed her breast.
Mm-hmm.
Do they still do it like that, or can they take it out and leave some of it?
Yes, that's what I was mentioning for my sister, and I'd met a couple people before her that had some breast conserving surgeries, they call that. Mm-hmm. It was very interesting. I'll just be down to earth. I saw a glimpse. I mean, I'm not just looking at my sister day in and day night. She showed us a picture she took right after her surgery. It looks like, if you've ever seen someone was say big breasted and then they lose a lot of weight, or anyone that's lost a lot of weight and they get the little hanging, skin. Well, the way they had taken everything, they conserved her own the nipples were still there, the breast tissue was all removed, but it looked like they sewed her back up, so the skin, the original skin that held her triple D's or whatever she had, the skin was still there, and her original nipples. They put in a spacer during that surgery, and then in January I think she's going to have reconstruction. And for her she didn't want an implant. She's always thought she had a little too much fat around here, so she's going to get the fat from here replaced up there as part of the reconstruction, which is possible. So yes, so you'll look more natural.
Okay.
Then the implant surgery goes more easily, because believe me, in my career, all through these years, I've seen many women that had their breasts removed, even in a few years ago, that it's just skin to bone right there. There's nothing left. It's not beautiful. If we're into beauty, ABCs of breast. Yes, so there's new techniques going on right at MD Anderson. And what I always hope is that from MD Anderson, where the techniques are kind of cutting edge, because that's a teaching hospital, because we're lucky that we live within a 2-hour or less drive of Houston and Galveston too, with your teaching hospitals, because that's where you're going to get your top care. The research is available, the research they've learned from, and research ongoing to learn future treatments. So we are blessed to live that close. Yeah. My hope is that enough of the knowledge and development from MD Anderson and UTMB trickles our direction to Port Arthur and Beaumont, so that we can stay here and still get the expert, top of the line treatments and cares that are available. Yes. So.
Crazy question.
No, there's no crazy question. Definitely.
Do we know why it returns? Why the cancer returns?
A lot of that has to do with the lymph node system, from what I know. Because if it gets in the lymph nodes, and sometimes again we're developing cancer, and sometimes we don't know it's there, and that's where I'll go back again and talk a little bit about exams and mammograms. But look, my best friend from church, I'll share her story next. She, it was interesting because it was the same year, the same summer that my sister actually, I think the same day they went back on July 25th, got the results of their biopsies that had done. I think they both had them done whatever time of right after 4th of July, whatever day, they both got the diagnosis. But my friend from church, Jeannie is her name, she didn't feel lumps in her breast. I don't even know when her last mammogram was. It wasn't too long ago. She was getting good medical care for other issues. She had a thing under her arm that was hurting her. And unfortunately for her, it took a couple of months to get a proper scan. I guess her PCP ordered a ultrasound of that area. Again, they at the time didn't know that what was under her arm was going to be related to breast cancer. But when she finally did get an ultrasound, they said, "This don't look good. You need to biopsy this lymph node." So her biopsy was from the lymph node, whereas my sister was biopsying from the lump. But when my friend Jeannie, it was ductal carcinoma, breast cancer, in that lymph node. So then they're like, "Oh, backtrack. Well, what's going on in the breast?" The regular mammograms in Beaumont weren't finding anything in her breast. Now, when she did, it was just weeks down the road, she was in MD Anderson, and they have even better photography. I mean, we've got cameras you can hold in your hand like this, and then I saw a guy here earlier with a really good camera. It's a little bit more fine-tuned, the camera. Same thing with some of the machinery, the mammogram machines, the ultrasound machines, the MRI technology. They're more freely utilized at MD Anderson. So my friend Jeannie, they had to really do an MRI with contrast of the breast to even find that there was anything in the breast. And she had multiple small little tumors, but yet what got stuck there and was there for months was the cancer in that lymph node. And unfortunately, she's right now fighting for her life with metastatic, probably the worst case scenario. 1%, 2% of cancers that were migrated to the lymph node can end up in the spinal fluid and brain. Cancer doesn't easily cross the brain barrier, and breast cancer don't commonly, but it can, and that's its route is through the lymph system and then in the spinal. So anyway, she was diagnosed, and again, there were some critiques I might have about how quickly that was recognized as a problem. What her symptom was. She's right now 15 months from her original diagnosis, something like that, and she was starting to have really bad tailbone pain, and then sciatica. She felt like it was sciatica, getting kind of numb in her leg, one leg. Of course, she's diabetic, but she takes care of the diabetes. But she went to an ER. She was concerned with really what brought her to the attention of the medical people a month ago was an unusual rash on her arm. She had lymphedema from because of again, when they take a lot of those lymphs, that's when some women end up with the lymphedema. So she was worried about a rash and sepsis, and so she was like going to get this rash, and then she would mention to the doctors at the ER, oh, besides I have this pain in my tailbone and my leg, which is totally numb. And I usually don't want to talk bad about ERs and medical field, but the ER doctor at local here in Jefferson County, they told her her leg was diabetic neuropathy, and they gave her Bactrim, which is a sulfa drug, antibiotic, it's very common. They gave her that for her rash and said diabetic neuropathy. Never batted an eye about anything. No scans, no X-rays, no nothing was done. Two things. One, she's allergic to Bactrim and sulfa, so they gave her something she's allergic to for a rash that was probably not even significant. But what made me mad was when they said diabetic neuropathy, and I don't know if there's diabetics in here, but usually you're not going to get so severe that one leg is totally numb, you can't feel it, whereas the other leg is totally normal. That's not diabetes. When you're less than 17 months from a breast cancer that was in the lymph node, the risk is that tumors and cancer developing in the spine or tailbone. It was in her tailbone. So it's a big long word for it. I can't really repeat the word without looking at the internet. But it's in her meninges. If you think of meningitis, see that's one of the layer around our brain and spinal cord, the meninges. So she is fighting. There are treatments because she's the HERS2 positive. So there are treatments to really extend her life, because I do see this as terminal, but to slow it down a little and give her a little more time to say goodbye. And in her case, it really hurts my heart too, because her first and oldest child is due to be married on Friday, November 1st. So we're bargaining with God for her to be alive and well enough to attend the wedding of her daughter on November 1st. So that's Jeannie. But Jeannie, again, strong Christian woman. She's pray with you. She's a prayer warrior like we heard this morning. And so she doesn't fear death. She's asked me and my husband to be there for her husband and my husband, good friends already. And she should just be there for her kids and husband. She knows where she's going to go when she dies, knowing the Lord. But it is tough when you're having a good, fun party on earth, not knowing that the party might be better in heaven. But, life and day to day. So we really built in to survive. So we want to live one another day. So be joyful each day. So, again, be awake, be aware, be your own best friends, and be of good courage, because Jesus Christ can get you through whatever your battle ends up being.
Yeah. So are they actually taking, when you take your mammogram, are they taking pictures of this?
Yes, they do try to include the lymph system. That's why when we're talking about mammograms, you go up to that little platform and they put pull on that. They are trying to get as much of that lymph picture.
Okay.
If there's any doubt or anything, that's why they usually, a mammogram can show you so much with the views. And then there's ultrasounds is, again, helpful to determine cyst and solid and stuff like that. MRI is kind of an up and coming. It's usually the MRI is not a routine test for the breast. It's not screening for breast cancer, but if there's highly suspicious, again, like my friend, they saw breast cancer in the lymph node, couldn't feel anything in regular mammograms or see. So MRIs, again, technology. It's like God's eyes are sometimes it's like semi miraculous, the things we can see and do with some of our technology, medical technology.
And again, the cyst that you get, because I've had cysts removed.
Cysts, yes.
No cancer.
Yeah, I did research the association between cysts, sugar, and inflammation, and those are not good things. So, and my mother, sugar. When we intake sugar, it can cause inflammation in our body. diabetics who run high blood sugar and their system, your body's not regulating blood sugar like it should, when everything's not working in working order, when there's that blood sugar stays too high, when we drink in sugar, it can cause inflammatory responders, and that causes inflammation within our body, our blood. That's why our blood vessels get worn out, and then the nerves to those blood vessels get worn out because their damage is being done by the sugar. But in the same sense, there's inflammation, and not only, diabetes is an inflammatory state if you really research that out. But my friend that had the bad cancer in Jeannie, she's again diabetic, so I don't know if her being diabetic, again having the lymph node so long there, other things that opened up that pathway for that cancer to enter her spinal fluid. I'm not sure, but things that are healthy for your breast and our bodies are again diets that are low in sugar, avoiding diabetes, things that reduce your risk of diabetes, and obesity, are the belly fat for one. If you got the hips and the thighs, they say the pear might be better than the apple shape. There's different things about that. Yeah, those are, again, we got biology. That's a bummer. Some things you can't change, but there are things we can change, and that would be, again, living as healthy as you can, avoiding sugary things, normalizing your weight as much as possible, reducing, if you're at a weight where it's heavy, if you can reduce a little, and stay active. Just walking around the block, do that every day. Moving your body, whether it's walking, jogging, working out at the gym, or just put on a little music and dancing around the house. That's very good exercise for you.
Now,
So,
is
yeah.
it just white sugar, brown sugar, honey?
All
or
that.
All of it?
Yeah, all of that. With that, if it affects your blood sugar and your need for insulin, that's you got to watch that. I met a woman.
I think I saw a hand in the back.
Yeah.
Is there was a hand up in the
Oh,
back?
yeah, sure.
Yeah, my doctor told me that I'm at the age where I don't need to have any mammograms done anymore.
Oh, I don't believe in none of that. I don't believe in none of that. You got off the road.
Yeah.
Now there is
Don't look that old.
You're right. What, can I ask how old?
76.
There's not a hard, fast rule on that. Yes.
Like you already, got an illness or something,
Yeah.
and you're not planning on having surgery, if they find something, then no. But if you're active, even at 75, even at 80, you got a lot of active 80 and 85-year-olds. I say yes.
Oh, yes, definitely, yes. I always tell some of the women in my clinic, I'll say, well, if you're kind of old or if so ill that you don't know who you are or where you are and you can't really get around, like poor grandma or great grandmother in the nursing home, we're probably not going to be screening her, and she's probably going to die of something else than not breast cancer. But yeah, if you're active and moving, you're in sound mind and body, then yes, you should still get mammograms. And I hate to hear that there's already doctors trying to put a cutoff time for that. I would never.
And did they change the years? Like one
mammograms?
insurance told me that I didn't need one until the next year, which would have been 2 years away.
Oh yes, I think that's starting to change. There's different societies or associations like American Cancer Society, and then you've got Family Practice Society. You've got OBGYN's, College of Obstetrics and Gynecology. So you have different entities that come with these mission statements and these advice. But yeah, I think I think they tried that about 10 or 12 years ago to announce that we were going to only do them every other year or whatever. But it's like, I think there's more deaths because the cancer is more advanced when you wait that long. That was another thing too, is early detection is always the key. A for always the key, early detection. And so with that, I'll back up and do we always heard that the age for mammograms is 40. And I always tell my women 40 every year once you're 40. They used to have all these things, every other year in your 40s and every year in your 50s. But I'd say every year in your 40, once you're 40, and then if the risks are different, and that's where those conversations come in with your family, how many women in your family or even men have had breast cancer in particular, we're talking about breast cancer, but have the conversation, know the family history, the age of your mother or sister or grandmother, if they were young, if they were pre-menopause or 40 or younger, then you we'd want to start your mammograms younger. So I don't think I see any 30-year-olds in here, but if you were 40, you were diagnosed with breast cancer, then your daughter needs to have at age 30 begin mammograms. So it backs up earlier ages. And I would say, yes, so be aware of that. Now, does anyone still believe in or do the breast self-exam? All right, good. Again, that's still an important key, because a lot of the tumors that are found by the patient themselves, or sometimes the partner of the patient. Again, breasts are important, part of our body, not just for breastfeeding, but for beauty and a little fun sometimes for people. So a little personal stuff here. Again, it's a part of the body that shows. I mean, so it's not like, well, there are cancers that happen inside the body that are harder to access and harder to test for and screen for, but this is a very accessible body part. So we're going to do our exams. We're going to check for the lumps. We're going to get those mammograms. And don't be afraid to talk about it. Don't be afraid to get tested. Don't be afraid of the diagnosis. There's hope, and be of good courage, and Jesus Christ will get you through it. Okay. Anything else? That I don't know, except for the MRI, but until the MRI become more. It is no fun. Now, another body part is I deal with is the Pap smears. Now there are some rules on Pap smears and age cutoff, but it shouldn't be generalized for each person in the general public. It has to do with your history too, with your uterus and cervix and Pap smear histories and stuff like that. But they do tend to see cervix cancer is a little bit different than breast cancer. But again, it's a fairly easily accessible body part. It is inside the body, but there's a pathway to get to it, and that's where Pap smears become important. And even though you think, a lot of women come to me driven because they're told they think they need the Pap smear, but I really encourage them to come every year, even though you may not need a Pap smear in your particular case. But we do need to check your body. Let's check those breasts, get that mammogram, and again, don't be afraid of the test that gives you a diagnosis, because there's good treatments and there's good hope for a future.
You had another question.
Yes.
I was thinking that is the age limit is really a factor in getting tests for mammogram or breast cancer. Is it really a factor? Because I was in my 80s when I discovered that I had.
How old was that? Were you? Or how old are you right now?
I'm 87.
Wow, you look really great for 87. And that's what, if someone would have, just don't even get any tests once you turn 75. That just seems so young to me for a woman's life.
Stop doing the Pap smear.
The Pap smear, Pap smear, we've determined that the age is between 65 and 70 for a woman who still has a uterus, has a cervix. You have to have a history of normal before we retire you from Pap smears, let's say. But I don't know, breast, I feel different. That's not really an age cutoff. Our risk, well, most of the little brochures will say 1 in 8 women, that's just average women. The risk increase with age, and that's one thing, biology, we can't change. So just being a woman and living every year after age 50, your chance of cancer increases. So even women that live to be 90, they may get cancer just because of the age.
Pap smears, are those supposed to be regular now? I haven't had one in over 20 years.
Well, Pap smears should be if they're normal. I mean, if I meet a woman, I might do it a couple of years in a row to see that they're normal a couple of times. If they're normal on the track record, then we can skip up to 3 years. And in some cases, 5 years, but that's a real detail. That has to do with being tested the cells of the cervix. The basic Pap smear tests the cells of the cervix for any changes that would reflect pre-cancer or obviously cancer. Women that wait more than 5 years to have a Pap smear, the chance of finding cancer increases because we just didn't find it early. Again, early detection is your chance for the cure. So if they're normal, never had anything abnormal, and you're tested, now they have a co-test, a partner test that goes along with the Pap smear cells. It's a test for HPV, which is human papillomavirus. And we can test to see if that is negative. If HPV is negative on your Pap smear cells are normal, and you've got that several years in a row, at least 3 times out of the last 10 years, let's say you're 65, and since you were 55, you had all 3 good ones, you could probably retire from the pap smear once you're 65. But if, let's say you're 65 and you haven't had one in 20 years, let's do one and see what it looks like. Then we'll determine if you needed a couple of more, or if it's abnormal, there's a whole other pathway. You'll need one every year for 20 years. So it's all really individualized to your track record.
Yeah, complete hysterectomy.
Yes.
Should you?
The woman with a complete hysterectomy, technically the pap smear is really looking for cervical cancer, and typically if you had a complete hysterectomy, you don't have a cervix anymore. What gets you into the doctor or the gynecology specialist or women's health specialist, it opens the door not only for vaginal health. There are some things that can occur, very rare vaginal cancers, but that's usually left behind after abnormal pap smears, HPV issues as a young person. I don't know what the future holds for that now that HPV is circulating so generally in the population. But I don't have to do one if you don't want one, but I would at least get a baseline if you hadn't had one in a long time, because we can detect the condition of the vaginal world, if other things, things are falling out that don't belong, like the bladder falling, and yeast infections. I've diagnosed women getting their pap smear or having a yeast infection. I've been able to diagnose them with diabetes because they don't realize their blood sugar is so high. They just have terrible yeast infections, and they come to me with that problem down there. So there's a lot of things we can tell about your health by a pap smear or vaginal pelvic exam. So just come see me. I'll let you know what we can do next.
If I may.
Yes.
If I may, tell a little bit of my story. Many of y'all already know me, but I speak this from the standpoint, I guess I better stand up. I speak from the standpoint of being on top of your own health. When 3 years ago, when this stroke happened to me, my lovely wife was just, forgive me for not saying the right terminology, but she had just became successful in her battle with cancer. She was victorious, praise the Lord. Mm-hmm. Well, right after that, I had my stroke. It'd been a tough year for PATX. Mm-hmm. And I just had my stroke. And my wife was at my knee helping me through that whole process. She may not want me to share this, but from the standpoint of safety, let me share it. During that process of her taking care of me while I was recovering from my stroke, she opted out to have her annual checkup. After her recovery, after she was declared no longer having cancer, and I think there's a bell that you ring, forgive me, she rung the bell and everything. Taking care of her husband, it became time for her to have her annual checkup. She denied that checkup because she was taking care of me. Forgive me, this is very sensitive for me. But she did not do her annual. And as many of you know now, she's battling her second round with cancer. The doctor, while we were in the office and received the news, the doctor was telling her, Miss Pat, you did not come in last year. And if you would have came in last year, we would have caught it earlier and wouldn't have had to go through what she's dealing with now. Why am I sharing this with you? Regardless of your current situation, regardless, we're at an age now where we all, male, female, black, white, green, polka dot, it don't matter. Annually, if not every 3 months, you need to be seeing a doctor.
Yes.
And it's just important. And I know some of these tests can be challenging, uncomfortable, difficult. I've got to do the men examinations, and brothers, y'all know that ain't pleasurable for any of us.
Yes, that's not easily accessible.
I don't want any of that. However, we pray to God that he would divinely heal us, and we should. But we don't walk in divine health.
All right.
We want divine healing, but we don't walk in divine health. Part of that needs to be your responsibility of checking yourself every year. Please hear me, y'all. This is very personal for me. And I know it needs to be personal for you. Don't wait until something happens wrong, and then you look to the medical professionals to come through and save the day. Even if you feel perfectly fine, go get your checkup annually. And make sure I go every 3 months to get my checkup. If I don't, I got a team. Mona is one of them and say, hey Eddie, you been to the doctor lately? And we get that taken care of. And so I implore you, forgive me for talking, but I hear the question, so my home testimony needs to be a response. My wife is wonderfully strong and battling through what she's dealing with even right now. But I can't help to think, if she'd have went to that appointment while she was taking care of me, we may be in a totally different place right now. And so again, I implore you. Gulf Coast is making it easy. This is my shameless plug for Gulf Coast. We're making it very easy for you to get that screening. Right now, we're offering free. Somebody say free. Free. Yeah, I knew y'all jump on that. Free screenings for cancer. Which screenings? All of them. I know we got 2 or 3 men in the house. All of them. We're offering free screenings at Gulf Coast Health Center. And so we would like for y'all to please come in. I can schedule for it even right now. I'm not here just to wear this red shirt. I'm here so that if you want your test, your screening, we can help get you on the schedule for that right now. I don't think about all the Miss Sheila.
Oh, no, you're right.
Okay, so
we take walk-ins same day. If you just wake up one morning and don't even have an appointment, just say, I need to get my breast checked. I'm going to go see Miss Sheila.
Yeah, we can make that happen. Y'all know me. If y'all don't remember Gulf Coast number, y'all know me. Call me. We'll get it set up. Y'all know Mona. Call us. We'll get it set up. We're making it accessible so that you can get it checked out. I feel fine. I just want to see Brother Eddie's face. Good. Come see me, and we're going to get you checked out. All right? Thank you so much. Thank you, Miss Sheila.
Okay, yes. Any other questions or comments? I think I'm done. I mean, I'm sure we could talk forever and ever, but there's a lot of things to talk about. And talking about the 1 year point, my sister had just had everything checked in December and January because she had reached menopause. So she was, feeling terrible. The hot flashes, started getting hormone replacement to feel better. So, again, in June, her birthday was June 24th, 2023, she felt the lump. Everything was all clear, nothing was wrong in January. If she had waited till the 1 year point, I mean, that should have been probably goner by then. So don't, or even if it was 2 months or 6 weeks from the 1 year point, if there's a lump or a change, then get help. Don't wait just for 1 year if you suspect anything. Oh, and I don't have the kit that goes with this, but there's a friend of mine gave me this when I worked at UTMB. This represents the size that we might find tumors in the body, and all this depends on the woman's habits. This is a woman who didn't know anything about breast self-exam. She didn't really check herself. By the time she did find a lump, it's fairly big. You can see that from here. Now we got women that they self-breast exam every once in a while, and they might have lucked out and found something, but it's still pretty big. When you back up at let's say a woman who's getting her mammograms every year, she self-examines. You can't even see how tiny that is. Sometimes there's that tiny we can find on the mammogram that it's more curable, obviously, and less likely that it's extended to the lymph nodes when we find it this tiny. So if y'all get a chance, if y'all want to come up here and get some more brochures and take a look at this necklace at the sizes of the tumors. So anyway, sorry I don't have enough to for everybody. Maybe next year we can build the whole necklace with the beads and everything.
Thank you for all of the wonderful information that you gave to us, and we will certainly keep those things in mind. I have a couple of announcements. There's a women's conference at Mount Calvary Baptist Church, and the dates for the conference are November 15th, that begins at 7 o'clock. Then there's November 16th, that begins at 9:30 a.m. Then November 17th, 10 o'clock a.m. So if you would like a t-shirt for this conference, I can give you the information. So, because you'll need to get in your reservation rather quickly. Or if you want any other information about the conference, I'll be glad to give you a brochure. The second announcement comes from East Mount Olive Baptist Church. They are having a Titus Women's Conference. It's going to be November 6th through the 7th, and it begins at 7 o'clock p.m. One of the speakers is Minister Yvonne Howard. Y'all know what a good speaker she is.
Yeah.
So if you're interested in attending that conference, I have information on that also. Does anyone else have any other announcements? Miss Paula?
We just want to thank our guest, LB Ray. We want to thank everyone for coming out for Mount Sinai Women Ministry, hosting this walkathon. Thank you for all our guests, LB Ray for 6-shooter for capturing all the event. Our members of Winners for Life, through our proceeds will be going to Winners for Life organization who sponsor raise funds, purchase mammograms for women who are uninsured. So we thank you. Christina Watson is one of the members, and myself is here today. So we want to thank you for all of what they're doing, and thank you all again for coming out. Gulf Coast Health Profession, Mona Foots, Sheila, and Eddie Patton. We thank you all for sharing that information with us today.
Oh, yes, thank you so much. Doug Foots, I'm telling y'all, Brother Foots is a winner. Brother Foots helped us so much put these things together, and we really appreciate him, as well as Brother Green and Brother Zeke Jones. And again, Brother Cyrus, we thank you for the picture taking that you're doing. So we had a lot of help this time, and our women's ministry and work and helpers that help them and help everybody to get these things together. And so we thank you so much for coming. You look so good.
All right. Thank you.
And you're gonna be on TV, I believe. Do we have any other announcements?
I did want to say, Ms. Sheridan, please, everyone, take this information that we have up here on this table with you. It is free. You can have as much of it as you want to, because we don't want to pack it back to Gulf Coast.
Yeah, and take some to a friend that's not here today, perhaps. If not, if that's it. Thank you again for coming.
Breast Cancer Awareness 2024.
All right. Keep going, y'all. Keep going.